We are having one of the largest outbreaks in tuberculosis in the history of the United States. And what's even crazier is we currently have a pause on communication of federal health agencies. And so it is very important that you stay up to date with evidence-based medical professionals online, such as Dr. Rubin, Dr. Beestrom, and myself. So if you're not already doing so, make sure to give us a follow. And now let's talk about this tuberculosis outbreak. Currently, the outbreak is in Kansas City, Kansas metro area. And unfortunately, there have been 2 deaths, and there are dozens of illnesses ongoing with tuberculosis. My sincere condolences goes out to the families that have lost their loved ones and those that are currently impacted by tuberculosis. The first cases were reported in early January of 2024, and now the cases has slowly been increasing over time, and it is still ongoing currently. As it stands right now, there have been 67 people that are being treated for active tuberculosis, and there are 79 cases of latent tuberculosis. Latent tuberculosis is pretty much where tuberculosis has been detected in the body, but it's not currently causing active disease. Now, tuberculosis is a bacteria that is spread through prolonged close contact with someone that has active tuberculosis. So tuberculosis is a bacteria that spreads through the air. So when someone's talking, coughing, sneezing, singing, things of that nature, it can be spread, and usually is through prolonged contact with someone with active TB. The typical symptoms of tuberculosis would be cough, fevers, weight loss, and night sweats. Screening and testing for tuberculosis is done through a variety of mechanisms, usually through clinical evaluation and examination, skin testing, sputum cultures, chest x-ray, and blood testing. The good news is if you get diagnosed with tuberculosis, there are treatment options. Unfortunately, it is a prolonged treatment course of multiple different antibiotics. With the tuberculosis outbreak ongoing and the pause in federal health agencies able to communicate, make sure to follow evidence-based health creators to stay updated on this outbreak and as it evolves.